first, we continue with our rolling coverage around COVID-19 and the situation in our country. Let's give you a cross-section of how things are looking. Our reporters are at various strategic points across South Africa. Bonga Zwilane is in Durban for us, Ahmed Kaji in Malva Vats in Johannesburg, Linda Mnisi in the capital. But first, we start with Athi Mtongana, who's at Khayelitsha for us this afternoon. And Athi, it's one of the first weekends, if not the first one, in fact, under this revised level 3 restrictions. Get us a sense of how that's translated where you're at.
A very good afternoon to you, Ayanda. We're coming to you live from Rands in Khayelitsha. It's a very popular recreational and social gathering establishment. We were actually here a few days ago with the National Liquor Traders, who are hosting a workshop where they hosted about 100 tavern owners from in and around Khayelitsha, where they were training them and just giving them a refresher's course on the compliance as per, like you mentioned, the revised alert level 3 lockdown. However, I am joined by Buzwe, who is the general manager here. Buzwe, we're seeing that some seats are empty already. We know that there are a couple of changes in as far as this level is concerned. 50 people inside, 100 outside. What is the situation looking like now, considering that it's the first weekend since the announcement of alert level 3?
Things are not looking very good. Part of the reasons why the seats are empty is because we have to comply. It's not because there's no business per se. So we have to keep a few spaces empty so that we can comply. Also the fact that, for instance, a lot of people, they're not really going all out these days because, for instance, the curfew really hurt the clientele, even potential patrons. You know, everything is just focused on going home early, and it's hurting the industry. Yeah.
How are you ensuring, briefly, as I'm about to let you go then, how are you ensuring compliance from the minute someone enters this establishment? We know that when we arrived, they scanned us and sanitized us and wrote our details down. Are you monitoring the number of people that are coming through? We did also have a discussion with the owner, who said to us sometimes it becomes difficult to turn people away, particularly patrons who love this particular establishment.
Okay, so there's a procedure we have. I think we think that it's a standard procedure for everyone. So from the moment you park your car, there's marked signs outside for you to stand in line, making sure you keep your distance. And when you get to the gate, we do what everyone does. We check the temperature, we record the temperature, we get your details, full details, including even, in some cases, most cases, even your address. That helps us keep track. So, for instance, there's 77 people in already. So the way that we know it is because on the papers, everyone who comes in, they sign. Now, that also doesn't make smooth operations, because now people have to stand for some time outside. And then when it comes to people flocking and then congesting outside, it's a bit of a problem also, because we can only control the space inside. And people, they stand outside, you know, they want to come in even though they've been advised to go home, we're fully packed, but they still stay outside, and it doesn't look to be a safe, yes.
Thank you so much, Mfundo, for your time. It is going to be very difficult for establishments like Rands to continue with their businesses, considering, of course, that this is now alert level 3 lockdown. Even last week when we were here, they did express concern about the lack of support from government in as far as funding is concerned. But of course, they do have to comply with COVID-19 regulations. We just came from the Gauteng hospital where loved ones are actually lining up outside the hospital waiting to visit their loved ones, considering the fact that this is the last day for hospital visitations, as per the department's policy, saying that no visitations in hospitals will be allowed due to the third wave. And just the rapid increase of positive COVID-19 cases and those active cases that they're still continuing to monitor here in the Western Cape. Ayanda.
All right, Athi Mtongana, thanks very much indeed. You speak about the limitations to visiting hospitals. We'll touch base with Linda about that in just a moment. First, let's stay with entertainment news, so to speak, and get a sense of how these regulations are affecting dining areas. Ahmed Kaji, you're in Emerentia, a place around this time of the weekend that would be a hive of activity. Not much of that today.
Yes, Ayanda, that is exactly what is taking place here out in Emerentia. We're just on the corner of just going down the main road through Emerentia, heading towards Greenside, on Barry Herzog Avenue, heading towards the Randburg region. And on the left, what you normally would see is outlets such as Pizza Hut, which would be behind me. You then have Wimpy on my left, as well as Ocean Basket. Some outlets at the moment are absolutely empty, Ayanda. It seems that business for them has absolutely stopped to an almost standstill, and it seems that on that front, by just opening their doors, they seem to be going at a loss. Some outlets, on the other hand, are then having about 40 or 50% capacity. One outlet we went into had about 25 or 30 people inside. I think on the positive side, thankfully for them, the premises was big enough for them to actually cater for the 30 people or so and still be under that 50% threshold for the number of people within the establishment. Earlier on, we had spoken to a few restaurant owners. One had told us that over the weekends they are losing at least 120 to 200,000 rand a day. That's simply due to the fact that they are not just getting enough customers in, and even when people do come in, it seems that it would just be cheaper to have no customers and close the doors and just pay rent, because just turning on the stoves, turning on the electricity, having to pay members of the staff their salaries on that front would just mean too much. It would just be too expensive for the owners to run on that front. And in terms of traffic coming through, things are more or less expected to quieten down over the next hour or so, especially considering that trading hours are now looking at 9 p.m. with some even closing through around 8:30 or 8 p.m. to allow cashing up processes to take place and then for staff members to make their way back home. Ayanda.
Haji, thanks very much indeed. He's in Emerentia for us. He speaks about counting the cost of these lockdown restrictions. And Bonga Dlulani, I imagine entrepreneurs in Durban are doing exactly that too.
That's correct, Ayanda. I'm at a popular spot called the Copper Chimney. It's a very popular Indian restaurant that's here next to the North Beach. And I'm just getting a sense of how is that affecting the new regulations, affecting business owners. And the man to speak to here is the manager at this popular Indian restaurant. That's the Copper Chimney. And his name is Saeed Raja. He joins me now. Saeed, thank you for your time. You said you're very busy, but I want to get a sense, the first weekend of the new regulations are just at level 3. How has it been, the impact so far for you as a manager of this place?
Thank you very much to ask me that all thing. And basically, right now this COVID-19 is very bad. We understand that one. And also about our business, if you can see, is affect is lot. Is basically affect the whole world, and mostly the business is affected more. And because the business is affected, the economy is also, the country's economy is also going down. We do understand that one, but we hope so it's going to be well, and we all be going to be safe. We just pray for that.
Now, see, it's usually a very popular time right now. Holidays are coming out. Do you think you'll see the level of business you used to, or will things take a dip with the June holidays coming out and people coming to Durban to enjoy themselves?
Actually, you see, this decision is the government can take, what they want to do it. Because if its cases is going up like that, then I don't think so they have that any holidays or anything, function or anything like that. Because if COVID is going like that, it's very hard to control and that all. Then have to government take the decision, and I hope so that government take the good decision.
Saeed, thank you for your time. That's Saeed Raja here. He's the manager at a very popular Copper Chimney here next to the North Beach. And as he said by himself, you know, infections are rising and government is doing the best that they can at this moment. They understand the issue that they're in, but at the same time, it doesn't minimize the impact it has on his business. I mean, holidays are coming out. Zikala said a few hours ago that they expect cases to rise because that Durban is a coastal town, Durban is a destination town, and people expect to flock here, but at the same time, COVID-19 is in the third wave of the country, and it will be devastating if they don't adhere to regulations. Nyathi?
Bongazilani, thanks very much indeed. Stand by. And of course, Linda Mnisi, all eyes on Gauteng as it tries to fight the throes of a third wave. You're around Steve Biko Academic Hospital. Get us a sense of what officials there are saying, if anything, about how we can stem the tide.
Well, Ayanda, you'll remember that during this time, especially because Gauteng is in the eye of the storm, it will be all hands on deck, doctors, nurses, and everyone in the hospital, or in the medical fraternity is quite busy at this moment. This hospital, you'll remember, recently also had to take on some of the patients that were coming from the Charlotte Maxeke Academic Hospital. But now, with the surge in the number of infections, the big question is around how hospitals are coping, especially with intakes, especially patients that are COVID positive and need oxygen and all of those things that are needed when one is battling the virus. I'm joined now by the hospital CEO, Dr. Matabo Matebula. Thank you so much for your time, Doctor. We've been seeing the numbers increasing day by day. In fact, Gauteng, over the last 24-hour cycle, reporting over 8,000 cases. That, of course, indicates that there will be some hospital admissions. Talk to us about the admissions here in this hospital and what that is looking like where COVID-19 is concerned.
Certainly, we are realizing that we are peaking. At this point in time, we have, as a complex, when I talk about Steve Biko, it's a Steve Biko Tshwane District Complex. As you know, our COVID positive patients get admitted in Tshwane District Hospital. We have a total of 225 beds, of which currently we have 106 patients admitted. We still have capacity, but the capacity is not to let people ignore the regulations, because it's determined also by availability of staff. If the staff get infected because the community is infected, then that will reduce the capacity that we have.
You mentioned that you have got 225 beds. I mean, if things get worse and out of control, will you be able to have more beds to accommodate those people that may need hospitalization?
We will have, if you look on your right hand, there are piles of boards that you can see there next to the tents. They are meant to build. We are in the process of building additional capacity. They are individualized isolation units that if it hits, will expand our capacity. But we hope not, because it will mean that expansion happens in this building. The building that we have said we want to continue our highly specialized services in this building. Hence, we are using our district hospital to admit the COVID positive patients.
Talk to us about your oxygen points. We know that over the past became one of the biggest concerns, that people would get to hospitals and there wouldn't be any oxygen tanks. I see just next to where we're standing there is one point. Talk to us about your capacity and what you have and what you're using so far.
Okay, the patients that are in the tents here, like we have said before, are patients that are awaiting results to decide whether they are positive or negative. Once a patient is positive, then the patient gets admitted in Tshwane District Hospital. If the patient becomes negative on COVID-19, then they get into this building. But the patients that get into the tents of Steve Biko Academic Hospital are patients that are very ill. They are those that we categorize as priority 1 and priority 2. When a patient is a priority 3, they go to the Tshwane District or emergency unit or the tents at Tshwane District Hospital. Now, The patients that are in these tents need high oxygen. Some are on ventilators already, some are on assisted or just the highest volume of oxygen. Therefore, we need a stable oxygen supply. The cylinders, as you can see, we have got few cylinders. They are not for ventilating patients. They are for when patient is getting moved from one area to another, or when the patient is being screened before they get into tents. In the tents, we have got a piped oxygen. The flow is through two pipes, through two reticulations. One is the main tank that is supplying the entire hospital, which is the primary oxygen supplying tank. That is monitored by AFROX and get filled as any time when it indicates that the oxygen capacity is falling down. And then the tank that you see behind us is actually a backup tank. It has got its own oxygen piping that also goes into the same tanks, just in case oxygen falls low from the main tank.
All right, there you have it. The CEO of Steve Biko Academic Hospital, Ayanda, speaking to us about a number of issues including bed capacity, oxygen. As you may know, when, of course, the infections surge, there will, of course, be those concerns around oxygen. She speaks of also the doors just on my left, saying that they will, of course, be used to build, extra capacity if the needs. There is, of course, a need. He talks to us about, how many patients they have in the facility, COVID-19 patients they have in the facility, over 100, and they have a bed capacity of 225. Ayanda?
All right, Linda Mnisi, thanks very much indeed. And that's a snapshot of your country. Linda Mnisi, live to us there from Pretoria, Bonga Vilane in Durban, KZN, and Ahmed Kaji in Emmarincha, Johannesburg. To all three of you, thanks very much indeed.